Good too.
Well, you too. Yeah, we're redlining the fun meter here, so we're all set.
All right.
Pleasure to be talking with Dr. Ken Redcross, and Doctor, what a great name for a doctor.
Oh, I know. It's funny. It shows you that the good Lord has a sense of humor, Bill. That's for sure.
I'd never seen that surname before. I was just when somebody called me at first, I said, "Is this? Are you serious?"
I know. It's funny. It's actually a Native American last name.
Is it really? How cool!
It is.
How cool is that?
A small tribe called the Monacan tribe out in the Maryland area. So we all know each other. That's for sure.
Wow. That's great. Well, you talk about you've got a book out about kind of a family relationship with your family physician, and tell me why that's important. Why people? Well, listen, my family physician just retired a couple of months ago, and I'm bummed.
Yeah, I know. You know, and I was going to say that's good and bad. Obviously, that's bad for you and going forward, but it's also good because you underscore how important it is, because the doctor should feel like a member of your family, Bill, and that seems like that's what you sort of felt as well. And so that's the big sticking point here today, is that I want everyone out there to have as good a relationship as you had with your physician moving forward, because it improves your healthcare outcomes, and that's what we all want, to be nice and healthy.
What is the importance of that as much as anything, Doctor? Give us some of the specifics you talk about in your book.
You know, some of the things I talk about, in order to get that relationship, you want to have 4 things with your doctor that needs to actually go back and forth between the two of you, and that's trust, respect, empathy, and communication. And I find that when all 4 of those are kind of humming along, Bill, you have a really good relationship. And once again, this increases your healthcare outcomes. You have that relationship to be able to open up to your doctor. Your doctor has the time that you deserve to also keep you healthy. So this should be an exchange back and forth. And it takes some time to get, especially in this current healthcare climate that we live in, Bill. But once again, everybody out there listening deserves that sort of relationship.
Well, Dr. Redcross, I think that the appointment times sometimes seem rather short to develop a true relationship with your doctor. I know that we have a doctor shortage, and of course, especially since the Dalai Lama decided, that medical genius decided to come up with Obamacare. I've had doctors talk to me, said, I need to spend, sometimes a half an hour or more with a patient, and I have 10 minutes.
I know. Well, actually, you're lucky if you get 10 minutes. The average, Bill, is 7.5 minutes. How about that? Give me those 2.5 minutes back.
Jeez.
So it's a big challenge. But, there's some things that you guys can do. Since the appointments are so compressed, think of 3 things. Number 1, before you go in, strategize. Make a list, because it's easy to forget things as you go along. But if you go ahead of time, that way you'll have a little bit of a checklist. The second thing is, when you do get into the doctor's office, Bill, I want everyone to repeat the information. That helps with retention. They did a study, and it showed that patients only remember about 20% of what the doctor says during the visit, and half of it is wrong. So repeating actually helps that, everyone. So let's do it. And last but not least, ask questions. There's no such thing as a silly question. We all learned that in grade school, but it's true, especially when it comes to your health. Make sure that you're kind of a little proactive for your appointment.
Well, and one of the things that for us guys is, my doctor always said, bring your wife in with you, too.
Because I love that. I need to add that on my list of things. I need to change that. That's number 1, everybody.
Yeah.
Bring your wife, if that's it, a wife or your husband, whichever. But bring somebody else.
Yeah, because you're not going to remember when you get home. You're going to say, he said everything was fine.
Exactly. And unfortunately, it doesn't always play out like that. So it feels great to have another pair of ears for sure.
For sure. Dr. Ken Redcross with us this morning, and it seems like a lot of doctors, Dr. Redcross, are against taking supplements. So how do you start a conversation with your doctor to find out about supplements are the right things to do and all? And you see a lot of them advertised now, you take these and you're going to feel like you're 20 again in a few days, or you take these and also your ED problems are going to be over, or whatever it is.
Yeah, no, and you're right. And everyone obviously has a little pie in the sky, okay? So let's step back a little. Let's look at what some of the data shows. Look at what happened during the COVID epidemic. One of the vitamins that really was shown during this time was vitamin D, everyone, because vitamin D isn't just a bone story. It's an immune system story. And all of you out there, if there's one thing you do when we get off today, I want you to Number one, get to know your vitamin D levels by either going to your doctor's office or you can go to a website called thepowerofd.org. You can order an at-home test kit. And when you get your levels back, I want it to be between 40 and 60. That's kind of the sweet spot, Bill, where the studies showed a lot of the benefits, especially for immunity. So, that's one of those things that even the doctors outside in the Western community, I'm Western trained too, everyone, here at Columbia in New York, but I learned so much about what vitamin D can do to impact patients, and especially during this time of the coronavirus, to make sure that our immune system is raring and ready to go should we see that.
Well, Doctor, I think that's excellent advice. My wife and I had both been taking vitamin D3 on a pretty high level, and they called us. We had the COVID test, and they called and told us that we were testing positive. We tested positive, and we thought they'd had the wrong number. Because we had practically no symptoms whatsoever. I went through about a week where food didn't have much taste, but other than that, that was my only symptom. And we have the antibodies now and everything else, and they keep telling us to take the vaccine. Wouldn't it be easier to and a lot cheaper to tell schools and everything to make sure the kids and everybody else has vitamin D3 rather than go through these millions of dollars of hand sanitizer and masks and everything else?
Well, I'll tell you, Bill, it's funny. You should go on a mountaintop and kind of sing some of what you're saying. I'll tell you. But look, I understand. Obviously, we know hand hygiene is important and all those things too. But, Bill, to your point, look, this discussion of vitamin D, and I have some patients who are like, Doc, I just don't feel comfortable. What sort of options can we talk about? It's that vitamin D story, which I love to talk about because it's inexpensive and you get such a bang for your buck. Look at the studies. You look at the African-American population, almost 88%, the Latino population, almost 78%, the population as a whole, the billions around the world, almost 50-something% and lower in their vitamin D. So it's something that we all could utilize. And for my patients who feel like, they're kind of suspect as far as whether the vaccine is good for them or not. That's a discussion for your doctors, everyone. But vitamin D should absolutely be a part of your regimen. That's kind of a no-brainer at this point. And then talk to your doctor about some other alternatives that could be beneficial for you.
Dr. Ken Redcross with us. Dr. Redcross, what about those embarrassing things that you really don't want to tell your doctor, or you sort of give half-truths about something or other? How can we overcome that?
Yeah, and those are challenging, guys, because, look, during this pandemic, there's some things that have unfortunately been revealed. I've had patients who had to be honest and say, Doc, I started drinking, or I got into a drug problem, or I haven't been eating like I was supposed to, or I started smoking. But all of that is around this kind of stress and isolation that we've all felt for the past 15 months. And so that's the reason, back to Bill, when you were talking about that close relationship with your doctor, you got to have that kind of relationship in order to be honest and say, Doc, I need your help. I'm embarrassed. I know you've known me for years or months, but I started doing some things that I know aren't great, and how can you help me get there? And so that coming clean is not easy, but when you have that relationship with your doctor that you deserve, it should be a little bit easier, because that's what we're here for. Like I said at the beginning of the segment, a doctor should truly feel like a member of your family, and if that's the case, you can talk about some of these things as you come clean.
Well, isn't that the truth? And Dr. Redcross, you call yourself a concierge doctor. How did you become? And what is that, and how did you become one?
Look, guys, so I got really frustrated with the current healthcare system, seeing 30 people a day, not being able. You guys can tell I like to run my mouth, and I can't run my mouth if you want me to see 30 a day. But if you want me to see 2 or 3 a day or 4 a day, that is what I can do through concierge medicine, because I'm there on your time. My practice is a little different here in New York, everyone. I make house calls. So you'll see me in the city with my little black bag, or I have patients who are in different states where I just provide advice for them during their healthcare experience with their doctor. But as much as I can, that's what a concierge physician is, everyone. He's there, he or she actually is there on your time to provide access, convenience, and the time that, once again, you require, which is definitely more than 7.5 minutes.
Amen to that. And Dr. Redcross, we're heavily into shameless self-promotion, so tell us, give us more information about what you talked about today.
Sure, everyone. So by all means, please reach out. My name is Dr. Ken Redcross. You can find me on any of the social media platforms, whether you're a Facebook fan or Instagram or Twitter. I also have a book called Bond, which is the importance of the patient-doctor relationship, which is available on Amazon as well. But before all of that, feel free to reach out and say hello. I really mean it. I'd love to help you in your healthcare experience any way I can.
All right. Dr. Redcross, been a real pleasure. Let's stay in touch.
Absolutely, Bill. Take care, everybody. Have a blessed day.
You too. Bye now.
All right. Bye-bye.